Mm. So, a warm good morning, good afternoon, good evening to everyone who is here. Thank you very much for joining us today. And we're going to be listening to some interesting topic today. And this is actually our first meeting since the new Rotary year. We've all been so busy. And so, welcome to the new Rotary year for us. And this is our first meeting. And I'm going to start it off with the four-way test. The four-way test of the things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendship? Will it be beneficial to all concerned? And over to you, Vidya. You're muted.
Used to Zoom since physical life has started. For the purpose of some of the new people here and who may be joining us on YouTube and other places, Rotary Action Group Mental Health and Hygiene was founded around COVID. A bunch of us women got together and said we need to do something. And when we found out that period poverty was a reality, not just in developing countries, but across the world, even in developed countries like UK, and we said this is something we should work on, and that's how we got started. Uh, and we've been actively working across the globe to promote reusables, among other things. So it was of great interest to us, when I read this report by Earth. So let me quickly introduce to you Dr. Sharath Iyengar. Uh, Sharmila, maybe you can just spotlight him.
Yeah.
He's a pediatrician and a public health specialist who's stationed in Udaipur, Rajasthan, India. He heads the Rajasthan-based non-profit health organization, Action Research and Training for Health Society. ARTS is the short form. ARTS mission is to help communities and access and manage healthcare according to their needs and capacity by using research and training initiative. This organization works on research, service innovation, and also ground level training, providing support to the government on sexual and reproductive health, neonatal and child health, health systems, and also in policy. Trained in pediatrics and public health, Dr. Iyengar has worked for the United Nations Population Fund in India, provided technical assistance on quality of contraception, maternal health, safe abortion, and neonatal health. He's on the steering committee of Common Health and Indian Coalition for Maternal Neonatal Health and Safe Abortion. He's also a member of the Policy and Guidance Committee for Health on the Government of India and on the Government of Rajasthan's board. So this is Dr. Sharath Iyengar
Thank
for
you.
you. I met Dr. Sharath almost 5 years, as a part of another organization called Equitable Health Access. And I was really surprised to, hear and speak about mental cups and behavioral change. I was really astounded that rural women can be open to something like this. But what we're going to see today, they managed to convince 5,000 plus women to buy the menstrual cup. So that's really what we are going to hear about, because I think each of us in different geographies, we are trying to work on adoption of menstrual cups, and we know the challenges that we are facing. So today, I think between Dr. Sharath, Piyush, who's the Deputy Program Coordinator at ARTH, and Gunjan Khorgade, who's a Research Associate, they're going to walk us through what they have really done and inspire us. Over to you, Dr. Sharath.
Thank you, Vidya. And I will not take time. A very warm greetings to all of you. I've had some abrupt travel and therefore I'm miles away, down under, as they say it. And my first visit to Australia to settle my son into his studies. I wish to emphasize only one issue. What you're going to hear is about a lot of effort made by persons in our organizations spotting an opportunity in a community where cloth pads have been used, homemade cloth and locally purchased cloth has been used for period protection. And we wondered, just like people jumped from no telephones to the mobile phone without ever having gone through the landline phase, would it be possible for them to use an environmentally friendly option like the menstrual cup without having to necessarily use sanitary pads? the disposable pads. This effort has been led by the women in our organization working with women in the community. Persons like me, and I wish to, disabuse everyone of this notion that I'm the one leading this effort. Yes, I have been heading the organization, but it's the women in our organization who've been putting in all the effort to make this a reality. Gunjan is one of them, several others too, and they've reached out to the women in the community. I do believe very strongly that when it comes to issues of menstrual hygiene and menstrual health, the women need to lead and the men should be there to support them in what has been a very stigmatized area of their own personal concerns, privacy, mobility, and their daily lives. So I'll stop here and Vidya, we can then go on with the presentation beginning with Gunjan. Thank you.
Thank you, Dr. Shah.
Thank you, Vidya. Thank you, Dr. Sharan. I'll just share my screen. Right. Um, so the presentation is divided in two parts. I'll be covering the menstrual hygiene aspect, the environmental aspect of it, and how did we introduced menstrual cup in our setting. And my colleague Piyush will talk about the research and analysis part of it. So in the context of India, the fourth National Family Health Survey for the first time asked about the use
Sorry,
of
can I just stop you? We can't see anything actually. It just
one
says
minute.
that you
Back
started
screen.
sharing.
Yes,
You have to
Gunjan,
double
the
click
screen is
the
not
Just a
seen.
second. I'll share it again. Just a second. Is it visible now?
Yes, it is. Thank you.
Yeah. Okay. So, in the context of India, the National Family Health Survey for the first time asked about the use of modern menstrual hygiene products among young women. By the way, they have not included older women in this survey. So, for the matter of fact, there has been increase in use of modern menstrual hygiene products on the part of young women. As you can see in the chart, there has been significant increase in use of sanitary pads from 42% in NFHS 4 to 64% in NFHS 5. And this is similar even in case of rural women. And there has been, oh, second. Just a second, there is some glitch. Yeah. So there has been factors which have contributed to this growth. So greater market penetration, aspirational brand marketing, availability of different sizes and price ranges of sanitary pads. Even narratives in mainstream and social media was around adoption of sanitary pads. And even some celebrities and through films, there was greater awareness about sanitary pads. And of course, government initiatives further increased the access of sanitary pads. Um, We then looked at some key government initiatives in the context of India. So in 2011, Ministry of Health and Family Welfare launched a scheme for promotion of menstrual hygiene, under which it included distribution of sanitary pads at a subsidized rate. The same ministry in 2014 launched a program called Rashtriya Kishore Swasthya Karyakram, which is commonly called as RKSK, under which there was free distribution of sanitary pads, especially for adolescents. Now, when we look at it from menstrual hygiene lens, these schemes have focused on disposable sanitary pads. Even the communication around it was heavily pad focused. In 2015, Ministry of Drinking Water and Sanitation issued national guidelines on menstrual hygiene management, and it recommended that sanitary pads should be available in schools, toilets, separate toilets should be there for uh, girls. And in 2019, Central Ministry launched oxo-biodegradable sanitary pads, which were made available through fair price drugstores. We also looked at some Indian state government initiatives on menstrual hygiene management, including Rajasthan, where we are working. And what we have found that most of these schemes have focused on disposable sanitary pad. Now, let me briefly talk about what menstrual cup is. So, menstrual cup is a bale-shaped device which is made up of inert medical grade silicone, which also means that it does not alter vaginal pH and it hence doesn't increase the chances of infection. Now, this medical grade silicone is water repellent, which also means that the fluid, including blood or soap, does not stick to it and it can be washed off easily. Usually, it is available in three different sizes. In the left side, the image you can see, depending on the cup's capacity, there are three different sizes available, and this is as per UNFPA specifications. Now, how do one use the cup? So, women have to put the cup inside her vagina by herself. Where it fits firmly, it creates a suction and it collects the blood. And it can be worn for up to 8 to 12 years, 12 hours, and it's a reusable product, so can be used for 10 up to 10 years. Now, menstrual cup has been available since 1930s, but due to limited social acceptability, only a fringe group, educated urban women had access to this product. But the internet review has shown us that in India, there has been more than 30 menstrual cup brands available. Uh, in 2019, the Lancet Public Health Journal published a systematic review on menstrual cup use and acceptability. Now it covered around 436 records and 43 studies were included in this, and some of these studies were Indian studies as well. So what the review has found that menstrual cup is an effective and safe hygiene option. It creates less leakage compared to other menstrual hygiene products. The review also talked about the fact that initial familiarization is required for adoption of menstrual cups, and peer support makes it easier for women to adopt it. And they have also emphasized the fact that even in low and middle income countries, there is high acceptability of menstrual cups. And then there are some efforts in India. There were some efforts to introduce menstrual cups in India. So, in one district of Kerala, there was free distribution of menstrual cups to women. Similarly, in 2022 in Karnataka, two districts introduced menstrual cups to adults and girls. And recently, Hindustan Latex Limited also launched two brands of menstrual cups in India. Apart from this, there has been some studies in Gujarat, Karnataka, and states of India, uh, and what they have found that among the attributes that women prefer, ease of insertion and removal, mobility, privacy was ranked high. Then we looked at environmental aspect of menstrual hygiene products. So disposable sanitary pad is multi-layered. In the left side, you can see there is this top layer which comes in direct contact with the body. Then there is this transfer layer which transfers the blood to the absorbent core where it absorbs the blood. And then there is this adhesive which glues together all the layer. Now, when we looked at the composition, apart from fluff pulp and release paper, 49% of disposable sanitary pad is non-biodegradable. Similarly, when we looked at tampon, 10% of tampon is non-biodegradable. And in case of menstrual cup, 100% menstrual cup is non-biodegradable. However, menstrual cup maintains its integrity and it does not breaks into microplastics. It is reusable product, so can be used for up to 10 years, and the silicone is also recyclable. Now, in terms of sanitary pads, there are oxo-biodegradable sanitary pads available, but the issue with these pads is that it breaks down into microplastics, and we know that microplastics are stays in the ecosystem for a longer time and are more harmful. We then wondered how much waste would a woman generate over her lifetime with the use of menstrual hygiene products. And so we compared the waste generated by different menstrual hygiene products, including sanitary pads, tampons, and cups. So we have assumed 30 years of menstruation for women. Now, I know some of you might say that it's longer, but considering the period of pregnancy, even after pregnancy, there is period of amenorrhea. Even some women are using contraception these days, and that might lead to period of amenorrhea for them. So we have assumed 30 for the calculation. One can take more. We have also assumed 12 cycles per year. Although with 28 days cycle, it can be 13 cycles per year, but we have assumed 12. We have also assumed 5 days of periods and 10 sanitary pads or 10 tampons per cycle. So on calculation, what we have found is that with the use of disposable sanitary pads, a woman would generate around 28.8 kilograms of total waste over her lifetime. 49% of this is non-biodegradable, leading to 14 kilograms of non-biodegradable waste over one's lifetime. With the tampon, similarly, 7.2 kilograms of total waste would be generated, and 10% of tampon is non-biodegradable. So that means 720 grams of non-biodegradable waste would be generated. Now, menstrual cup is can be used for up to 10 years, but assuming women would want to change the cup every after 5 years. So we have assumed 5 years for the cup. And considering that a woman would require 6 cups over her lifetime, so that would generate total and non-biodegradable waste of 60 grams. Now, what we have concluded from this is that the use of menstrual cup can lead to over 99% reduction in non-biodegradable waste. Now, how did we introduce menstrual cups in our area? So we are working in 2 districts of Rajasthan in India, uh, covering a population of more than 4.5 lakhs, and we are working in 468 villages. So we already had a delivery platform with a community intervention called Taruni, uh, and we had a network of 480 community women whom we called community health entrepreneurs or CHAs. So their role was to educate women. They used to sell low cost commodities, including sanitary pads, menstrual cup, and um, this they also sell these commodities, and they would also refer women and accompany them to clinics if required. Now they would also have to undergo some training. So there is this immediate spot training which is done immediately after recruitment, and then there are subsequent trainings for the CHS to undergo. Some of the training modules that she had to go are contraceptive choices, menstrual hygiene management, entrepreneurship. How do she sell it? Uh, And then we went and talked to around 61 women and asked them what do they use during their periods and how satisfied they were with the products they were using. And what we have found that majority of women used either discarded cloth pieces or locally purchased. There is this thick maroon colored cloth which is commonly called as lal kapda or red cloth. So the issue with red cloth is that uh, it's a very thick cloth and one has to discard it after 3 to 4 months. Women have also reported discomfort while walking with it. Staining and leakage was major issue reported by these women, and that led to their restrictions in their mobility. So that women would not travel during their periods, they would not go outside their homes, and if they are working on field, say in the month of June and July when they are expecting rains, so the rain would soak right through their clothes, and people would notice that oh she's on her periods, which would be very which would not be comfortable for women. We also asked them about disposable sanitary pads, and they said that yes, it's good, but the question was, where do you throw it? How do you dispose it? So they would have also, women have also reported that their neighbors would notice that a woman is going at an odd hours, not to fetch water or do any kind of work, but she's carrying some polythene, understanding that she's, throwing pads, which was very embarrassing for women. And so in 2019, on World Population Day, we launched menstrual cups in our area. So on the left side, you can see in the image, the the one who is holding the cup is renowned gynecologist in Udaipur. So she is Dr. Vinaya Pense, governing board member and also a supporter of menstrual cups, along with the government representative block panchayat. Uh, so we So we branded our menstrual cup as Ritu cup, referring to Ritukal meaning menstrual period in Sanskrit and Ritu meaning season in Hindi. So referring to it's an all season cup. We made it available in 3 different sizes. We retrained our community health entrepreneurs on how to use the cup, how to support women who are using the cup. Now the role of community health entrepreneur was to promote the cup, sell the product at a very low cost, which is like 150, less than $2. And in the process, she also earned some margin. Now, we introduced menstrual cup in our area as an menstrual hygiene option. without looking down on other practices. So women in our community, including community health entrepreneurs, menstrual products if they want. We also developed some communication materials around it. So major messages that we had was cup was a very effective option, that there would be no leakage, no stains. She can perform any kind of work. She can travel, so it does not restrict her mobility. No one would know that she is on her period. So privacy was maintained. We introduced messages about cost effectiveness and how menstrual cup is useful for working women, especially those who had long working hours. So one of such target audience that we approached was police women in Udaipur district. So we had this event where we introduced menstrual cups to these women, and we had two gynecologists who also answered their queries if they had any. We also have video on how to use menstrual cup, and I can share the link with you. But internet review has shown that there are more than 50 different languages that showed how to use menstrual cups. And with that, I will hand over to my colleague. Just a second.
Thank you, Gunjan, and that's Piyush who's
Thank-
taking over.
Yeah.
Just a second.
Hello, everyone. Thank you, Gunjan, on briefing about the menstrual cup part. I will carry on with the key learnings we gained through this Taruni intervention in the community, and which tells about use and acceptability among our users in the rural area. Uh, This slide shows about the menstrual cup distribution. All the women are purchasing from our community health entrepreneurs. We call them as Taruni Sakhis. And as the women are purchasers, so we believe that they are willing to use the menstrual cups. Starting in July 2019, you will see these are the financial years. So starting in 2019, we saw that there is an interest, and in 2020 when the COVID came, it had an impact because the lockdown restricted our distribution channels. And but in 2021, we saw that there was increase in demand because we continued working in the community, and uh, there was absence of the supply through of our other methods in the community. So from 21 to 23, we saw the increase in the demand because there were no alternative methods much available in the rural community. As the lockdown phased out, then there was a decline because other things were available. Still, there was a significant demand, and by end of financial year 25, we are hoping to be there will be around 1,300 women who will be purchasing menstrual cups. Uh, we were
I
also
just wish to
supplying.
add, uh,
Yes.
Piyush, I just wish to add that state government introduced free sanitary pads in the year 2023, just before the election, and they flooded all the Anganwadis with free menstrual pads, and that led to a much greater increase in uptake on part of women of sanitary pads given out free by the government in large quantities. That impacted the cup. So these are ups and downs that we have observed.
Yes, sir. I was also coming to this in this slide. So,
Hmm.
sanitary pads were also purchased by women through the same intervention. It is we started distributing in much earlier in 2015. The demands slowly grew, and again during the lockdown period, there was impact, but later the sanitary pad we were the in many of the villages we were the only source providing sanitary pads. So due to the issues with access and no alternative supply, there was high demand. But as soon as the lockdown phased out, and as Dr. Sharad was mentioning about the UDAN program of Rajasthan government, where it was introduced in 2022, and later in 2023, they pushed their supplies. So they, due to huge supplies, and the women are not like purchasing in the rural areas. So there is a sharp decline as we see in 2023-24 to till date. Uh, Looking beyond uh, the sales part, uh, we actually looked into what the users are telling us about their experience, uh, and that experience was very crucial in actually further promoting menstrual cup in the community. So, as in this slide, you can see that the women are telling about uh, how they have like after like using cloth for over long period of time when they switched to cups. So what changed? So mainly it is about uh, the reasons they gave were about that they are feeling good because there is lack of space for washing and drying the cloth. There is discomfort in walking, especially during the rainy seasons. So that kind of discomfort was something which after using cup was not there. There were also issues with uh, disposing the cloth or disposing the pads in the community. So here, with after they used the cups, they were relieved from that discomfort or issues, and they were also concerned about the environment issues like if we throw our pads into the into a nearby vicinity, so cows will eat it up. So such kind of issues were there. So this helped us in like pitching the uh, things like the concern for the environment in the community among the community members. Uh, we also tried to look at uh, if the women users experience change with the type of product they use. So we shortlisted some cups, some brands, and then we compared, uh, uh, taking the opinion of the users. So 60 women were provided menstrual cups. Out of those, 58 gave their opinion. They rated their experience on a 5-point scale. And we like comparing both the cups, we got almost same rating on for the different parts using the cup, and also about how they handled the cup over time. So this shows that there was no significant difference between the two types of cup, but actually some women were initially they took some time to get the practice of inserting the cup and removing it. Rest, it was like most of them agreeing that cup use and it is like something which can be easily done by any women in the community. From 2022 to 24, through our routine intervention, our mobilizers were going to the community and they were following up with the women users. So we like got responses from over 11 and around 1100 women in the community, and we asked them that in the past three cycles, what was their experience for, and did they use the cup or not. So we, a majority of them, 82.1% of 1097 women, they use at least once during the last three cycles. Among these 901 women, we asked them, did you use it regularly or were you switching? So they said out of these 901 women, 83.4% use in all the three menstrual cycles. We also asked them that did they use any uh, uh, other method with this with cup. So again, 79.2% of 901 women said that they used only cups. That's what we got. Some other women who were among the 20.8%, they were bit reserved that okay, uh, uh, we will use cup, but there might be chances of leakage. So that's why they parallelly they use pad or cloth. So here, what we are sharing is among those 1097 women in the past three menstrual cycles, so that is 1097 multiplied by 3, that becomes 3291 menstrual cycles. So in 3291 cycles, the cup coverage was 65.1%, and 17% cup plus other method, it was cloth or pad, so it was there. So around 80% of the menstrual cycles were covered by menstrual cups. In the same Among the same women users, 129 or 12% were adolescents, and these adolescent users got menstrual cup from their, usually from their mothers or some other women in the family, and we saw that 80% of them were using cups, although there were few things where they were worried, and they showed that they showed that they need some convincing, and they need their, I mean, they need some counseling over these things. Uh, Women, we try to gather some information on women preferences for storing the menstrual cup, how they store between their menstrual cycles, how they store the cup. So we provided the menstrual cups in a cloth bag, and they preferred that thing. Initially, we tried small boxes for them, but they preferred the how they store the menstrual cup in their home or carry with them. So the cloth bag was more convenient for them, and that's why we are continuing with the cloth bag part. So among our community health entrepreneurs, uh, or what we call them as Taruni Sakhis, we also try to see, we provided them as a sample, and we try to see that do they like to use it or not. So 377 of our Taruni Sakhis received the cup, and we saw that 54.9% of them used at least once. And out of these 207, when we asked that, did you use regularly? So we got the similar pattern, that 80% of them use in all three cycles. And when we asked them about did they use any other method, so 90%, 91% of them said we use only menstrual cups. And why we did this was because we were interested in seeing that these women who are selling in the community, if they themselves use, uh, so are they doing better? And what we got from comparing the sales of the users versus non-users, we saw a higher cup selling performance among the users. So learning from the rural areas, we tried to extend this into the district, the Udaipur district, which contains 15 blocks. So in most of the blocks, we have like started this intervention. We have uh, gained some very crucial learnings that the entrepreneurship approach works for the distribution, and women are, if they are willing, they are ready to purchase it and use it. Based on that, we have focused our the extension of this intervention to major villages, so that the women gain the sufficient clientele. And the approach is to pick up the women entrepreneurs who are already doing something like tailoring, or having small shops for cosmetics and other items. So, using their entrepreneurship skills, they can easily convince women and provide supply the menstrual cups to the women. Using that approach, we are um, slowly covering the whole district. Uh, Coming to, like, I'm just concluding my presentation with, the thing is, as Gunjan mentioned earlier, that the significant amount of waste reduction is possible with menstrual cups, and this is I think with increasing use, and if women opt for this, they are willing to use this, then this will cause a significant waste reduction over upcoming next 10 years around. And also, as we see the other interventions of introducing menstrual cups among women in the community, we see that initial mentoring is very important. So this helps women in like practicing and using it over time, and the high acceptance is actually related to it. Our experience is mainly from coming from the men who are using earlier cloth and they are directly switching to cups. It may be slightly different, those who are using sanitary pads and then switching to cups. So I am ending my presentation with this. Uh, I request Dr. Sharat to add few points on this matter.
Uh, Thank you, Piyush. I just wish to add one or two critical points.
Yes, sir.
Yeah, may I continue?
Yes, sir.
Yeah,
Please.
I just wish to add one or two critical points. One is, this question on why not go around distributing these cups free. Many people are doing it, government agencies and other groups. There have been studies which show that of women who get the cup free, when less than 20% would start using it. That percentage went up to 50%. We feel amounts of money, not large. She associates the cup with some menstrual cup with value, and she is more likely to use it. The person providing it is also bound to go around explaining how to use it, because it's not a matter of just giving it out as a commodity. We're not sure that chemists giving out menstrual cups is the best idea. Most of them are men, and they may not have the privacy or even the capacity to explain to clients, given the stigma attached with this. So we have therefore used purchase as a critical way to take this ahead. And we found that there are many women who take part in entrepreneurial activities, tailors, beauty parlors, cosmetic shops. These are all activities that only women are associated with. And there's a bit of privacy where a shopkeeper deals with a woman customer. And she has this chance then to talk more about a new and a different product. Having said all this and having had an encouraging set of experiences, and we could go into more details, there are some caveats. The government of India has not yet notified standards for menstrual cups. You see, you don't have BIS standards as yet. We are hearing that draft standards have been prepared by the ministry. They are going to be released shortly. Once that comes in, the picture will hopefully change for the better, in that substandard cups, both at the level of manufacture and distribution, will hopefully decline and will get good quality. The cost might go up in the process. Currently, we are not guided by standards except for some draft suggestions by UNFPA. So I'll stop here. I think we should leave time for discussions and to take your views. But the critical point is there is an environmental role. The menstrual cups are eco-friendly. There is the feasibility of introducing it in communities in India where large numbers of women are still using cloth but are switching over to sanitary pads, especially when promoted free by governments. This has been happening. And for the sake of the environment, however, whether the government distributes free pads or women go buying it from the shops, the environment does get contaminated. And we have a major issue for a country of our size to try and do something about it. And women are willing, for their own personal needs, to contribute to saving the environment. I'll stop here.
Thank you, Dr. Sharath. I think this is a very interesting evening. For me, the most, biggest thing was young girls are using, unmarried girls are using. That is not an area we have really aggressively tried, especially in, countries like, say, India, for example. So that is one thing which really strikes me here. And the other, I think, is the idea of distributing through women entrepreneurs. This is another interesting thought for us to pursue to widen what we are doing, our reach. Thank you for this excellent presentation, Gunjan and Piyush. I would like to tell people in the audience that you can raise your hands and I will unmute you to ask your question. So please do raise your hand for your question, but I will start off with the question. One of the things, even in EHA, for example, I made a small presentation in EHA about menstrual cups, was that this was to a bunch of doctors through Dr. Evita. I think somebody in her team was there, and we were talking about menstrual cups. What I found that many of the doctors who are even gynecologists themselves are not sold on the idea of menstrual cups. So, I was telling them that you can adopt yourself and you can probably give it to your nurses. And many of them are not necessarily open to this idea of menstrual cup. Doctors themselves have reservations. So, can you tell us something about handling that reservations for doctors?
Uh, I have found that even experienced gynecologists who have not ever encountered the menstrual cup during their professional careers or personally have a lot of, hesitation and inhibitions. And on the other side, you have the young gynecologist resident or the woman MBBS student who has to spend long hours in wards. We have all know about this unfortunate case of rape and murder, how it has highlighted the fact that women doctors, women trainees, women nurses, women working in hospitals have to do long hours. And, apart from safety and security, even uh, toilets are not very easily available. And some of them have started using menstrual cups because they need to be emptied and cleaned out, I mean, reused less often than changing pads. And there is a certain number. I think this is a generational change. It's going to take time. The menstrual cup is not a very medical intervention. Actually, it is so ridiculously simple that in some ways it marginalizes specialists and doctors and clinicians. And a few of them, therefore don't think very highly of such an intervention. It's great at the level of women. It's not a medical intervention.
Yeah.
But I think more and more gynecologists and doctors as women, nurses as women, as they start using it, it'll gain currency.
I suppose that some of us are users, so we do not have the issue, and like you rightly pointed out, users are able to convert more easily than non-users. So that's another interesting learning for us. The floor is open. If others have questions, please put up your hand, and I will unmute you. I think while others, Yusuf, I have one more question. I want to know how easy or difficult was it to work with, you know, teenagers? Because I find that segment, we are a little wary of going and telling teenagers about the menstrual cup. We just kind of skim through in our presentations. We talk to them about sustainability and conscious consumerism and all, but we really never push the cup. So, what is your experience on ground?
Gunjan, would you take that?
So I think we also focus on adolescent, but our major uh, intervention has been with women. So we do understand that adolescent needs are there in terms of menstrual hygiene, but at the same time, there are large majority of women who need menstrual hygiene intervention. And what we had done is we went to the mothers or we went to the women from the family. If they had started using the cup, they would more likely to recommend menstrual cups to their either niece or daughter in the family. So that has been something that we had covered. So,
Thank you, Gunjan. I think Dr.
Yeah, and just
Meenakshi,
to add
an
to it,
active,
yeah,
active contributor to the scene, has some information to share. Doc, please go ahead.
yeah. If I may just, Vidya, add to
Yeah,
what
please.
Gunjan said, uh, we have not pushed the cup very hard among early mothers who have been providing it to their daughters. My God, how can young girls use it if they are not sexually active already? And we're leaving it to the mothers. They've made their judgments and they are providing it. So, like you, we are not promoting it actively, but neither are adolescents being denied. And look what's happening.
Okay. Dr. Meenakshi, and after that, Shivakarthika. Dr. Meenakshi?
Hi, Dr. Sharath, and hi, the team Arth. It's been very nice to hear your experience about this. When you say that, gynecologists are not open to it, it is because we are not taught about menstrual hygiene in our courses. We are taught about menstruation, but nobody talks about menstrual hygiene. So somewhere in the curriculum, we have to change it. And the young doctors are the best people to be converted to using a menstrual cup. So once the young doctors understand, then it'll take a little while, but I believe from my own college, the youngsters have all adopted to using the menstrual cup and are very happy with it. So we need to make it part of the curriculum for them to understand how good the menstrual cup is and how convenient it is, how they will be happy and not have period cramps also, and secondly, how it's economical. So it's a no rash, no cash, no trash program. So it will really help. And slowly they're converting. I believe it took 20 years for the panty to be adopted in the 1950s and 60s. So we have to give ourselves that time, but I don't think it'll take 20 years. In the space of 10 years, I think women will themselves spread the message that it is so convenient. The other myth is, of course, that the cup will break the hymen, but women would not be getting their periods if they didn't have a hole in the hymen. So the hymen already has a hole, and that is at birth. And as women understand it, and as gynecologists also understand it, because we were all taught that, the hymen will rupture when you have the first intercourse. So if the women who go into the market can explain that to the older women who are taking up to using the menstrual cup, it will make a huge difference. Thank you.
Thank you. Thank you, Doc, for your words. Shivakarthika, I think, has some fresh experience. Shivakarthika, would you like to? Yeah. I think you're not unmuted.
Yeah.
Can you hear me?
Yes, we can.
Yes. So I'm Shivakarthika. My role at EHAC, Equitable Healthcare Access Consortium, is I work as a manager there. I joined very recently, and we had a meeting in IIM Udaipur where the team from Earth presented this menstrual cup awareness and how they have tried to implement and distribute the cups and bring about that change in Rajasthan. So I am a recent convert. Since a year, I've become a user, and I'm kind of becoming an evangelist for the menstrual cup. And when I saw that through EHAC, this can be really, it can reach many people, then we approached Arvind and Oralab because I'm here at Madurai. And Dan Foundation also was very, very interested in taking it. So we've already conducted 3 sessions, awareness sessions. And surprisingly, the most uptake was at the slum area of Kirathurai in Madurai, where the women were very happy to know that they would not need to change pads or worry about disposing pads. They were also very worried about how their streets were piled up with dust and dirt, and the dogs will pull them out and then leave them lying around for everyone to see. So it was very heartening to see that education or style of life doesn't matter when it comes to health seeking behavior. Usually the assumption is anybody who is educated or anybody who is well informed would take better decisions. But it was very nice to see that women were forthcoming to take it up. And we've also proposed this to married women first because of these concerns, social concerns that they might have, because of the culture, very stringent culture or ardent culture that is followed in the South. So married supervising staff, nurses. So we've reached out to them. So once they use it, we've asked them to talk about it to their own departments and younger nurses and doctors as well. So that way, it's very nice to see that women are wanting to make a change in the environmental aspect of it as well as the comfort factor for themselves. So recently we had these 3 sessions. So I wanted to share that point. I wanted to also thank Dr. Sharad, Ms. Gunjan, and Ms. Vidya for encouraging and supporting in with a lot of positive words to take it forward. And with there was a point that Dr. Minakshi raised and Ms. Vidya raised, that about for teenagers, how does it work? So for teenagers, for my own daughter, when we tried, it was the sizes were not very convenient for her. She's a very recent menstruator. So when I spoke about this to many people, I also spoke to one anchor person from Hindustan Lever Limited, who was actually taking this to police women and even nurses in Tamil Nadu state. So she was saying that maybe for the teenagers, if the size doesn't fit or if it is not immediately usable, we can wait for 2-3 years when they become 17 or 18, and then maybe they'll be more comfortable to use it. We can just wait for 2 or 3 years when they're comfortable, and then we can start using that. So we're also waiting on that. And we also spoke to a vendor asking for a smaller size for school goers if possible. So this is how we are also trying to do something so that we reach more people quicker and more people benefit from it. And I'm going to take Dr. Minakshi's slogan of no cash, no trash, no rash. I want to ask her permission to take it up and use it in the sessions that we'll be conducting henceforth. Thank you so much.
Please go ahead.
Thank you.
Yeah, we have any other questions here? I think it was such a
I have a
comprehensive
question.
Yeah, Sharmila, go ahead.
How do we overcome people who say, oh, menstrual cup, it's a scary thing. And also certain, like the Muslim community, how do you convert them? Because they're quite, I find them, or certain communities, let's put it that way, say it's a no-go for them. How would we approach them?
We need to speak
Dr.
to their
Sharma,
leaders.
You know that you work extensively in Africa and other parts of the world also. So I think we have some people from that part also here on the call today. This one, yeah. Dr.
We need
Sharad,
to
do you have
speak
any?
to the religious leaders and tell them that it doesn't come in the way of their virginity. So if they are convinced, the religious leaders are convinced, then they will be able to take it forward in their individual communities.
Okay, thank you,
Yeah,
Dr.
and
Meenakshi.
yeah,
Yeah, Doc?
if I may add one more point, this is there are two groups. We found quite a lot of resistance among educated women and communities where they're already doing well with the sanitary pad and then don't want to change it. The menstrual cup requires more effort and the insertion, the removal. It's a little more elaborate as compared to the pad which is used externally. The pad is really part of our use and throw culture. And the cup is more about, using, reusing, preserving, washing, looking after things and not losing them somewhere along the way. It's a different mindset. But when it comes to specific communities, it's more about poverty, lack of exposure, and therefore a fear of doing things to their own bodies. You see, there has been a stigmatization over years, maybe centuries. Women have somehow been schooled into don't play around with your body. Those are not things that you're supposed to know. And so they're embarrassed about it. So women would have to now start learning more about their bodies, what are the anatomical features, and that would actually help in many other ways to empower them. We just need a critical mass of people, as Dr. Minakshi is saying, that who use it themselves, are convinced by it, and then start convincing others. I don't think market approaches or company approaches or maybe even large scale government approaches are going to work. A last small point about virginity. The courts in India have said that you should no longer use the two-finger test. I think we should stop treating the hymen as some kind of sacred membrane. Virginity is about sexual behavior, and whether it's a good thing or not, I think is for individuals to decide what it means for their own sense of values. But let's not associate it with structural and anatomical features. Because a cup is used, it doesn't mean that a girl has started having sex. It just means that she started using a cup. And as I mentioned, there are various sizes which can be used conveniently. So I don't think we should glorify this emphasis on virginity just for women while letting the men go scot free, just because there is no anatomical way of determining whether a man is a virgin or not.
Thank you.
It's
Thank
also they
you.
need to understand. Women need to understand that if they're getting their periods, the hymen is not intact. That is something we need to explain to women, that the hymen is having a hole in it, and that is there for every girl child from birth. The percentage of women who have imperforate hymen is minuscule.
Yeah, so I think we are at 6:55, and I request Ines to bring this meeting to a close. Thank you, Dr. Sharath and team, for accepting my invitation. Ines, over to you.
Okay. Well, as you know, I am based in Buenos Aires, very far away from you. And first of all, I want to thank the whole team, the AR team, for making the effort to talk to us in this day. It's Saturday, so we all know that it's a day with family and friends. So first of all, I have to thank you all. But I have to congratulate you because, this issue is very difficult for everybody all over the world. It doesn't matter if it's more poor or a developed country or not, because we have found that though in the States or UK or some places that you can imagine that everybody knows how to use everything and they have the top of technology. Well, there are a lot of women and a lot of doctors that don't know what the benefits of these caps are. And so I'm very touched with you because as I read the numbers and I know more about the Indian culture and the Indian country, that it's very far away from me. But as a Latin American girl that I am, some issues are very, very similar, Perhaps our culture is not so similar, but in this particular issue, there is a stigma and a taboo when we have to talk about menstruation, when we have to put on the table different ways of managing menstruation. And as Dr. Minaski says, it's as important to educate the girls and the boys in the body and menstruation, as important as the hygiene of that. So that's all I have to say. Thank you very much from our group. I'm talking in behalf of all the RAG. Thank you.
Thank you.
Thank you
Dr.
very
Sharath.
much.
You're way past your bedtime, I think midnight in Australia. Thank you for staying up and being with us today.